Welcome, welcome, welcome to a new DJ Wilson STEM video. Uh, this particular video is again one of our STEM talk sessions. The goal of this video is really just to spark interest and knowledge about various topics. Now, this video we're going to be talking about one of the 7 technological areas of medical technology. It's going to again, we're just going to delve into it just a little bit. Okay. All right. So our agenda, we're going to cover what is medical technology, areas of medical technology, and obviously, one big thing is going to be careers in medical technology that we would like to cover. So, what is medical technology? We like to say medical technologies are things, one, that humans have created. We need to remember that all technology is stuff that humans have created, okay? With the goal of improving human life, okay? So, medical technology are things that humans have created with the goal of improving human lives. So, we talked about what is medical technology, but what is medical technology? All right, so let's cover a few of these. So, medical technologies can be obviously vaccines. Vaccines are things that we as humans use to help us prevent catching certain uh, uh, viruses or certain illnesses and diseases. Medical technology also includes surgeries, um, whether it is heart surgery, brain surgery, foot surgery, toe surgery, eye surgery, all surgeries. And again, we might say that um, surgery is not necessarily a thing, but surgery is a process, and anything human created is technology. So surgeries are a part of medical technology. There's a bunch of research within the medical technology field, which includes learning how to help us live better, learning how our bodies work, um, and what causes them not to work so well. Okay. Obviously, there are physicians and doctors, and there's so many different types of doctors, from podiatrists to surgeons to neurosurgeons to geriatrics. So there's all sorts of different um, physicians. And then there are uh, dental doctors or dentists who help us, make sure that we keep our chompers in good condition. And then there's ophthalmology, those who check our eyes. And again, glasses are a part of technology. So, and again, anything that humans have created. So, those who check our eyes or do surgery on our eyes for cataracts or laser correction. There's also medical records, um, and those who organize different records and put them together so that we can easily track our progress or lack of progress through our treatment of whatever we're going through. And there's also nuclear medicine. Now, nuclear medicine is a very huge area. It includes X-rays and MRIs and EKGs and all these different things that allow um, us to see on the inside of the body as far as what's happening and what's going on. Okay? There's many different areas within medical technology. And the first, and again, we're really just going over, some high level areas of medical technology. We're not going in depth, but the goal is to really kind of like spark some interest in this growing field. Okay. So the first thing that we kind of like want to talk about is research and development. So research and development are people who are assigned a problem to research a problem and find solutions. So, for example, if there's a pandemic or a problem, these are the people who would research and find out various solutions for that particular disease or for that particular treatment, whether it be cancer, diabetes, or something like that. There's a huge market, an area for research and development of various medical technologies. And that also includes robotics. We do know that Many surgeries are now being robot assisted. It might not be an artificial intelligent robot, um, but there are certain technologies of robotics that are assisting many of our doctors now. Um, then there's also clinical tests, and after, for example, for after a viable solution to a particular problem is found, so let's say cancer is a problem, we research cancer being a problem, and then there's clinical tests, and so um, these clinical tests are you have physicians and doctors, um, then they start to test on different animals and different things to determine how well the solution will solve whatever issue or treat whatever issue is going on. And then you have doctors and practitioners. And these are, if a successful solution is found, the doctors and practitioners are the people who will then treat the actual community. So, for example, for the researchers, when we're going back to that first step, it's going to be very rare that a researcher would actually meet with a patient, unless the researcher is, researching or working with patients and finding out more information about them so they can continue to do their research. But the majority of treatment obviously is going to be coming from the doctors. Okay? So that's kind of like a path of medical technology. And again, with each one of these steps, right, there are so many different careers that students can actually choose from. Okay? And obviously, that is the people. Okay? All right. So, one of the things we always do want to talk about are what are some ethical and moral concerns of medical technology. And whenever you're dealing with any type of medicine, there's always going to be potential room for abuse. Okay? One of the things that we do always also want to make sure that we say is that, and it's kind of like a common theme for our class for STEM, is that technology itself is neither good nor evil, right? But it truly depends on how it is used. So, whenever we are creating technology, there's always the potential. So, for example, the nuclear bomb, obviously, that was nuclear was originally about creating energy, and then obviously some people said, hey, well, if you create this type of energy, it could be used to harness a weapon or a bomb or something along those lines. And that could also be the same thing with any type of medical technology that could be used. For example, gene therapies and creating superhumans, or engineering viruses and pathogens and unleashing them on people who don't think like you or you're opposed to. Okay, so there are many ethical and moral concerns when it comes down to medical technology. Now, one of the best parts, and I really want to get into this, um, and we'll just cover a few of these. Um, and again, these are careers within the medical technology area. And we talked about researchers and clinical ethicists, and but there's also disaster medical specialists. So these are the people who would go to various areas, and if there was a major issue going on or a virus outbreak, these would be people that would go in that particular area and assist. All right, there's family medicine or primary care physicians, there's a pathologist, there's physicians assistants, there's radiologists, and again, radiologists are those people who run the x-ray machines and the MRIs, and nursing assistants, home health aide. There's a very big market for home health aid. And again, these are people who would go into a person's home and assist them with their medicines or assist them and take care of them. There's therapists, there's nurses, pharmacists, pharmacy technicians, clinical laboratory assistants, and so on. Okay. Um, Not only that, there's additional careers. There's psychologists, and obviously these psychologists are people who would study the human brain and why do people think the way that they think. Laboratory animal caregivers. So obviously we know that certain um, that many experiments are done on animals, and so there's people who are assigned to take care of those animals. Um, because unfortunately, the way that things work sometimes is that many times with animals that are researched upon may not survive whatever it is that they're being tested, or that's being tested on them. Okay. Then there's massage therapists, there's dietitians, or people who look at the the diet of a person, and maybe put something together to help that person live a better life or lose weight, or um, declog arteries, from whatever. Okay, cardiovascular technicians, medical equipment preparers, anesthesiologists. There's a huge market for anesthesiologists, and these are the people would um, who would give you a numbing agent if you were about to have surgery. Optometrists, chiropractors, um, psych, and obstetricians. So we know that obstetricians are people who help women have babies. Okay, so there's so many different areas of um, of medical technology. And again, I hope this short video was a benefit to you to determine some great areas of some great careers within the medical technology field that might interest you. If you're interested, obviously, a great thing to do would be to do an internet search and find out some more information. Okay? Again, thanks for watching, and be great.